Communication about the various options that are available for a patient is so important, but it isn't always easy, particularly because we now live in a world where two things have happened. There have been some really exciting advances in cancer treatments. So the perception is we can do everything, we can cure it, there must be something available. And the second thing that we have to deal with now are patient expectations. If they don't get good communication from the doctor, they are very easy prey for some of the awful things that you can find on the internet or even read in the press. The newspapers and magazines are full of information about alternative treatments, preserving this notion that everybody is immortal really and there's always something you can do to cure the cancer. We need to help doctors maintain honesty, sensitively, but with some hopefulness about the things that you can do to help the patient, even if cure is no longer possible. I think that explaining the options for patients should be easy because the doctor, of course, has lots of knowledge. They have at their hands lots of information that they've gained from attending meetings or reading the journals, the experience they've gained over the years. But trying to actually put all that information and their recommendations to a patient who doesn't come with that level of expertise, perhaps actually doesn't understand figures and numbers very well, the percentages, the graphs, the figures that doctors talk about, trying to actually understand some of the jargon, some of the strange words that are used. It's very difficult to ensure that the patient really has actually understood what the doctor's presenting. And of course, many things that the doctor might talk about, particularly when it does involve quite radical treatment that certainly for a limited period might actually produce some very nasty side effects. That can be very scary. So we need to develop ways of being reassuring as well as honest about the recommendations that we're giving patients. There are quite a few common problems that we see. I think most doctors are very good and trying to do a very good job, but some of the primary failings, I think, are using language that most lay populations just can't understand, not giving the patient time to process this new and sometimes scary information they're being given, or an opportunity to really question things that they haven't understood. And the other thing also is that I think many doctors pay only lip service, are less than, I don't know, they don't seem to really involve the patient enough in explaining why they have certain preferences, what are their lifestyle expectations that would lead the patient to make what perhaps as a doctor you'd think is an irrational decision. Trying to really elicit from the patients what they're all about. It's interesting, you know, we know so much about the individual cells that make up a tumour, but we often know very little about the poor patient who actually has that tumour inside them.